Hi, this is Dr. Peter Lee, and today we're going to be talking about upper blepharoplasty or eyelid surgery. And I'm going to be addressing specifically some of the more common questions regarding this procedure. The age limit for an upper eyelid surgery, a lot of times we're doing it for two reasons. One is for age-related sagginess, so the changes that occurs in our upper eyelid as we get older. And there really isn't any age constraint for an upper blepharoplasty as we get older. But the other times in which we're doing blepharoplasty is to create a double eyelid on Asian patients. And as far as that is concerned, creation of a double eyelid, it really kind of depends upon how mature and developed that eyelid is. We think typically that you shouldn't really do an upper blepharoplasty until you're kind of at the age of 15, 16. So in terms of how long the result lasts for, when we talk about like doing an upper eyelid surgery for, aging process, then again, it kind of depends upon the individual. Some people, they sag a little bit quicker than others, but usually we do talk about the effectiveness of the sagginess, the correction of the sagginess for about good 10 years. For an Asian double eyelid surgery, that's permanent, creation of a double eyelid. After surgery, it's really not painful. The surgery itself is pretty straightforward, and like any surgeries, there's always kind of a built-in innate risk with any type of surgeries like this. But because the upper eyelid surgery is done not under general anesthesia, but under twilight sleep, it's much less involved than some of the other bigger surgeries that we do. But in terms of probably the most common possible side effects and risks, we spend a lot of times addressing symmetry, because for a lot of people, just naturally, the two eyes are always different, and trying to make them as symmetrical as possible, that's what we actually spend a lot of time on. There are a lot of patients that we actually do upper eyelid surgery for functional problems, not just the appearance and the cosmetic component. So for example, there are some people with what we call ptosis, which means that the eye itself doesn't open up quite as much as kind of an average patient's. So some of the slang terms that we sometimes use are things like lazy eyes or sleepy eyes. And so ptosis correction is a functional surgery, meaning if you have ptosis, your field of vision is dramatically decreased. And therefore, doing the upper eyelid surgery and correcting that ptosis really does impact functionally how much you can really see. So some of the other sort of functional problems that happens is that if there's a lot of sagginess to the eyes, especially at the corners, that's when, again, you can have problems with visual field. And so cutting out that extra skin really does kind of open their field of vision up so that patient can see more in terms of their overall perspective. If there's significant sagginess to the corners of the eyes, then it does help with the crow's feet. But a lot of times crow's feet is generated by activity of the muscle. And certainly we don't really touch those muscles. So even after the upper eyelid surgery, there's going to be crow's feet wrinkles. So post-operatively, the recovery time is really dictated on how much swelling that you get. If somebody bruises easy, then you can get some bruising, but it's really that swelling. And because the eyelid skin is so thin, it does swell up more than other parts of our body and face. So one of the things that we really recommend patients to do, especially for that first week after surgery, is to try to rest their eyes as much as possible. Then that does mean not being in front of the computer too much, not being on your phone too much. The more that the patient can actually rest their eyes, which means closing the eyes and applying ice compression, that's something proactively that you can do to kind of speed up that healing process. But on the average, when we kind of take a look at the overall patients that we have, it does take about 3 weeks for good 70 to 80% of the swelling to go down. In order for 100% of the swelling to go down, it does take several months. But because there's really not much pain, for most patients, just extra strength Tylenol is sufficient for pain control. And then as far as taking a shower or washing the face, the patients can do that the next day, as long as they're careful around the suture lines. If you like this video, then please press like as well as subscribe. Thank you.